I'm Dr. Giyaur, and today I am planning to talk to you about blepharoplasty. So blepharoplasty is essentially an eyelid lift, and it could be upper blepharoplasty, it could be lower blepharoplasty. These are surgical procedures, but they're really mini surgical procedures. They can be done in the office under local anesthetic, usually with a little bit of some sort of sedation. So you could either have a pill that kind of relaxes you, you could have a little bit of gas, and that also helps you to feel relaxed. So upper blepharoplasty, I'll talk about that first because it's probably the most common cosmetic surgery that's done anywhere in the world, but for sure in the United States. So as we age, the eyelid skin is the thinnest in the body, so it ages first. It starts showing age usually in our late 30s, early 40s. And the skin, because it's so thin, it starts drooping. A lot of people, especially women, when they put makeup on, they start noticing that the shadows maybe don't last as long because the skin kind of rubs it off quicker, or they can't do the same type of makeup that they did maybe when they were a little bit younger. So usually in those cases, we can recommend blepharoplasty. Upper lid blepharoplasty is a fairly quick procedure. It takes about 40-45 minutes to complete. And the first couple of weeks, there's some recovery there. You need to put some ice in the first couple of days. You're going to be taking care of your eyelids for the next couple of weeks, but there might be some minimal bruising. But in 2 weeks, you can start covering it up, and usually the full recovery takes about 3 to 6 months, and by that time you usually look great. So I do recommend to my patients to not plan any huge big events for 3 to 6 months after the procedure. A lot of people ask me, is there anything to be done with the upper lids if I'm not ready for surgery? And there are some things that can be done, but obviously none of them are going to be as effective as surgical blepharoplasty. So then there's some people who, in addition, and usually it's in addition to having a little bit heavier eyelid, they're also starting to notice that the bottom lid does not look as fresh as it did before. So it could be skin changes, that the skin starts looking crinkly and crepey, or it could actually be that they're starting to get bags. And these bags are essentially fat that cushions the eye, and that's basically located around the eye. And that fat, as we age and the tissues kind of weaken and we lose some collagen, it starts protruding forward. And then in some people, and it's usually genetics, honestly, it's it's just the facial structure, and some people start looking a little bit tired. They're starting to look, they never sleep well, basically. So in those cases, we can recommend lower eyelid blepharoplasty. There's some things that we can do to kind of delay needing blepharoplasty. So it could be fillers under eyes. They really help very well to mask the eye bags. But once the problem gets severe enough, then blepharoplasty is the way to go. So our probably average age at which patients start seeking this type of procedure, specifically surgical blepharoplasty, either upper or lower, usually 40s and 50s and on. As a person starts aging more, sometimes eyelids can become really heavy, the upper eyelids, and start covering our field of view, so the patient may not see as well. And then at that point, it becomes a functional problem, meaning that person can't function as well with those heavy lids as they did before. The procedure is very safe. It lasts for years and years, so it could last for 10 years, the effect from that blepharoplasty, or even longer if you continue maintaining and doing some treatments to stimulate collagen. It's probably the most successful, the happiest plastic surgery that's out there and has the highest patient satisfaction rate. A lot of people are concerned with affording the procedure. You know, the procedure is a surgical procedure. It's covered by insurance. Only upper eyelid may be covered by insurance in very, very rare instances, usually in older people in who it does become a kind of a problem that takes away some of their vision. In most cases, it is not covered by insurance. And you know, in our practice specifically, we make it very affordable because we offer interest-free financing. Plus, in addition to that, we do offer to our patients laser resurfacing procedures after blepharoplasty as an adjunct, because that helps that result just last longer and just gives us much better result. If you think you're a good candidate, if you're interested in upper or lower blepharoplasty, please give us a call. I'll be happy to sit down with you for a conversation and a consultation.